Welcome to the webinar, Using Screening Data for Decision Making. This is one of 11 webinars that was developed by the staff at the National Center on Response to Intervention. And this webinar focuses on the types of decisions that may be made using screening data at the district, school, grade level, classroom, and individual levels. Decision making is an essential part of any RTI model. Data-based decision making is a part of the screening process, and data from the screening process are used for a variety of educational decisions. Data-based decision-making is not just for student-level decisions. RTI requires that entire systems, including schools, districts, and states, use data-based procedures at all levels of implementation. If you have not already done so, you may want to print out the accompanying handouts that go along with this presentation. My name is Dr. Rebecca Zumeta, and I will facilitate the next several slides. I am the coordinator of training and technical assistance and product development for the National Center on Response to Intervention. The National Center has developed a series of webinars to cover information that is important for implementers of RTI. On this slide, you can see that there are a variety of webinars available in this series. While you can certainly watch the webinars in any sequence, we recommend that you first watch the What is RTI webinar in order to ensure that you have an understanding of how RTI is discussed within this series. It is also recommended that you complete the Understanding Types of Assessment within an RTI framework and the What is Screening webinars prior to viewing this webinar. Following today's webinar, you will learn more about how to establish a screening process and select the best screening tools to fit your needs. Upon completion of this webinar, participants should be able to understand and describe the different types of decisions that could be made with screening data, learn how placement of a cut score can influence who is identified as being at risk, and analyze different types of screening data. One helpful way to check your understanding throughout the webinar is to complete the accompanying vocabulary handout. The handout provides a table with a list of key terms on the left side with columns to the right side for you to track your understanding before and after viewing the webinar. Before viewing the webinar, you should make predictions of the meanings of each term. Then, throughout the webinar, you will complete the final meaning column based on definitions provided, along with their space for a picture, sketch, or example where you can add anything that may be helpful for you in remembering what you've learned. You can see how in this example, I was able to clarify the meaning of primary prevention after watching the webinar. If you have not already made predictions for the key terms in this webinar, please go ahead and pause the webinar and do so now. Press play whenever you are ready to continue. Screening is intended for more than just determining who may need an intervention. Decisions can be made at all levels, including district, school, and grade level. The next series of slides provides examples of decisions that can be made at each of these levels. The data inform district-level decisions and support decisions about allocation of resources. District-level decisions related to screening may include decisions about program improvement and curriculum decisions, innovation and sustainability in terms of determining the model effectiveness of implementation of a particular curriculum or RTI model, the ensuring of equitable services and supports across schools, access to supplemental supports, ability to evaluate the effectiveness of instruction, and determination of a student who may have a learning disability. Allocation of resources and professional development may also be determinations that can be made with screening data. School-level decisions related to screening may include identifying general school-level trends or issues and grade-level trends. So some questions that may be asked are there holes in grade-level performance? Do we lose certain subgroups of students at certain times of year? You can also use screening data to evaluate the effectiveness of school-wide curriculum and instruction delivery. Is there consistent performance across grade levels? For example, data may indicate consistent growth from grades 1 to 4, and then a significant drop in performance when a student reaches 5th grade. This may be an indication that 4th grade instruction or curriculum is not adequately preparing students for 5th grade expectations. Finally, you may use screening data to determine areas of need and guidance about how to set measurable school-wide goals. Screening data can also be used for grade level decisions. So you can evaluate data to determine if there are trends in performance of an entire grade level. You can determine the effectiveness of the curriculum or particular intervention programs that are occurring at different grade levels. You can use the data to determine areas of need and guide how to set measurable grade level goals by using the initial screening data as a baseline measure or an initial measure of performance. You may also use the information to identify students who may need additional instruction or assessment. A cut score is a score on a screening assessment that divides students who are considered as potentially at risk from those who are considered not at risk. Cut scores might also be referred to as cut points or targets, depending on the tool. It is important to remember that cut scores used to identify students as at risk may not be the same way you identify students who require supplemental support. This is referred to as the target identification rate and will be discussed in more detail later. The success of RTI depends on accurate identification of students who may be at risk. This is an essential component of preventing costly identification errors. In a perfect world, the screening assessment would result in 100% accurate identification of students who are truly at risk or true positives and students who are truly not at risk or what we call true negatives. Cut scores are intended to differentiate those two groups of students who are at risk and those students who are not at risk. Cut scores are often set to over-identify students who are at risk, and this is because we would rather find more students who may be at risk and then determine through follow-up assessment that they actually are on track to be where they need to be at the end of the year than to have missed the opportunity to intervene with a student who may need extra help. Your choice of a cut score will affect the classification accuracy of an assessment. At the second stage of the screening process, progress monitoring may be used to avoid inappropriately identifying students who do not need interventions, but despite being identified as at risk through screening. Risk can be thought of in two ways. The first way is categorical, meaning the screener clearly indicates you're at risk for a poor outcome. For example, given the results on a particular test, you may be shown to either have a disease like sickle cell anemia or not have that disease. The other way is a continuous evaluation. This means that there are not discrete categories for determining whether or not a person is at risk. Instead, the responses fall along a bell curve. For example, a student's performance falls along a bell curve where some students do well and others do not. However, a child's performance on the screener does not 100% accurately predict whether or not they are at risk. The cut score is the best guess based on the data that are collected of who may or may not be at risk. However, other factors may lead to the over-identification or under-identification of students. For example, a student may have been sick on the test day, or a student is a word caller but lacks comprehension, or a student may have not been familiar with the examiner, which are all reasons that they may look like they have lower performance than they actually do. The establishment of a logical cut score is essential for accurately identifying students for additional assessment and supports and evaluating the effectiveness of those supports within the system. On this slide, we talk a bit about the clinical decision-making model. Again, in an ideal world, a screening tool would identify 100% of the students who were at risk and not at risk with accuracy. Screening tools, however, are never 100% accurate because there are so many variables that can affect performance. Screening tools vary in their sensitivity and specificity. Sensitivity is defined as the extent to which a screening measure accurately identifies students at risk for the outcome of interest. Specificity is the extent to which the screening measure accurately identifies students who are not at risk for that outcome. Ideally, the screener would only indicate that a student is at risk if he or she is truly at risk. When students are correctly identified as at risk, it is called a true positive. In addition, the hope is that the screener indicates that if a student is not at risk, it does so accurately. When students are correctly identified as not at risk, this is called a true negative. Unfortunately, screeners are not perfect. The screening tool might indicate that a student will be at risk when, in fact, he is not at risk. A case where the screener indicates that a student is at risk and the actual outcome shows that the student was not at risk is called a false positive. You may also think of this as a false alarm. Students who are incorrectly identified as at risk are, again, called false positives. Alternatively, the screening tool may show that a student is not at risk when in fact he is. This is called a false negative because the screener indicated that he was not at risk when the outcome shows that he actually is. In this case, students are incorrectly identified as not at risk with the screener. Additional screening and follow-up assessment are often used to verify the accuracy of initial screening results to help improve the extent to which students are correctly classified as at risk or not at risk. Another important consideration is the change in true positives, false positives, true negatives, and false negatives that occur based on changing the placement of a cut score. If you change the cut score, you will influence the number of students who are accurately or inaccurately identified. In the example on the left, 80% of poor readers are accurately predicted, meaning that they were at risk and based on the screening instrument and showed to be at risk based on the outcome. And 80% of good readers were accurately predicted, meaning that the screening assessment showed they were not at risk and the outcome showed that they were not at risk. At the same time, the assessment incorrectly classified about 20% of good readers and under-identified about 20% of poor readers. In example 2, the cut score was lowered. With the new cut scores, about 65% of the poor readers were accurately predicted as at risk, and about 5% of good readers were incorrectly identified as at risk when they actually were not. So in other words, about 5% of students were shown to be false positives. By lowering the cut score, we misidentified approximately 35% of the poor readers and suggested that they were not at risk when they actually needed additional services. So by lowering the cut score, we missed approximately 35% of poor readers. So where should the cut score be set? Typically, the best cut score is one that produces the most accurate representation of who is at risk and who is not at risk, as shown with the center line. In this example, we're likely to identify students as at risk as accurately as we are as students who are not at risk. Follow-up progress monitoring and screening will help to increase the accuracy of this identification rate. However, the cut score can be adjusted to meet the needs and priorities of schools or districts. They may ask themselves, should the cut score to be set to correctly identify all students who are not at risk but accept the possibility of missing a larger students who are at risk? Or should the cut score be set to correctly identify students at risk while increasing the number of students we may incorrectly identify as at risk or find out later are what we call false positives? Regardless of what cut score is used, it is critical that those interpreting the data understand the implications of the selected cut score. As noted previously, in most educational settings, we typically set the cut score so that we over-identify students who are at risk because we would rather find students who may be at risk and discover that they are actually okay than miss the opportunity to intervene with a student at risk because we set the cut score too low. The risks associated with over and under identification of students are similar to the risks found within a public health model. In public health, over-identification can lead to the higher expenses resulting from additional testing or unnecessary worry. In education, over-identification can also lead to higher expenses related to testing and early intervention services. In contrast, under-identification in public health can lead to missing a serious health problem, and in education, it can also lead to the missed opportunity to intervene early with a student and prevent the progression of a learning problem. To combat the costs associated with over-identification during universal screening, additional assessments such as progress monitoring or diagnostic assessments may be used to confirm or disconfirm the initial screening results. This is often referred to as the second stage of the screening process and can help reduce the amount of inappropriate intervention that may be provided to students who do not actually need that support. Establishing a cut score should be based on logical practices and be educationally relevant. Some screening tools use national norms to establish their cut scores. You could also use local norms as cut scores. Some data systems provide users with the tools to develop local cut scores based on outcomes on high-stakes tests in those users' particular states or districts. Similar district assessment tools and cut scores allow for comparisons across schools. Often, data are needed in order to establish norms at the local level. You could also use cut scores based on the likelihood of demonstrated mastery on core testing or on standards-based testing. This is also known as benchmark testing. A benchmark is a predetermined level of performance on a screening test that is considered representative of proficiency or mastery of a certain set of skills. Cut scores are often considered arbitrary, but they are actually typically based on statistical analysis that allows us to determine the point at which this assessment will best classify students into at-risk and not at-risk categories based on our outcome of interest. There are a variety of benefits for using district-established cut scores as opposed to using school-established cut scores. District-established cut scores may lead to more effective and efficient allocation of resources and allow districts to target schools with the greatest need, identify effective approaches in buildings that could be used for scale-up in other sites, can allow district staff to make decisions about resources that are based on data, and it may allow those decisions to be more timely and relevant to the instruction that is occurring in schools. The district-based cut scores may also help increase buy-in and use of the data by schools and teachers because district staff can clearly justify why the changes are being made. It also allows for a common message and focus around activities. It allows district staff to set more clear expectations across sites, and by having a common message and focused activities, district staff are able to not only evaluate overall performance of different schools, but also changes that occur over time. Finally, it may help staff to identify technical assistance and professional development activities that are based on demonstrated needs in sites rather than perceptions or wants of the staff. Finally, it has the potential to increase equity in the access to supplemental supports so that the schools that are most in need of resources are able to access them. Let's look at 3 schools in the same district. These schools have all established their own cut scores. As you can see from this table, School 2 appears to be doing the best, and Schools 1 and 3 appear to have fewer students reaching the cut score. Numbers alone, however, can be deceiving. If districts allocate resources based on school-based cut scores, students in School 1 and 3 would receive equal amounts of resources. In looking at this information, you might consider whether we are comparing apples to apples. Comparing the actual performance graphically, it is clear that School 1 is significantly outperforming School 3. While School 1 only has 50% of students at or above the cut score, its cut score is also higher than the cut scores for Schools 2 and 3. Because each school established its own cut score, it is difficult for districts to determine the actual number of students at risk and make comparisons across schools. Using a district-established cut score, however, it becomes clear that School 3 has much lower percentage of students at or above the cut score, only 4% than either School 1, which is at 44%, or School 2, which is at about 20%. School 3 would likely receive more intensive supports from the district because it demonstrates the greatest educational need. Even School 2, which had the highest percentage of students at or above the cut score in the school-based example, has only 20% at or above the district-established cut score. A standard cut score or target, as observed in this graph, across the district provides a more accurate picture of performance across the district and provides more accurate data for making decisions about resource allocation and targeting district supports. The National Center on Response and Intervention also recommends that teams establish routines and procedures for conducting data reviews, establish decision-making processes, and explicit decision rules for assessing student progress. This is an important task for district teams to accomplish so that there is some consistency across schools. When conducting data reviews, it is important to develop routines and procedures for how your team will review data. Data teams should conduct reviews at logical and predetermined times of year. You should schedule data reviews prior to the beginning of instruction, to the extent possible. Use established meeting structures or agendas, and then make sure that the relevant team members are involved in the process. It is also important to have established routines and procedures for data-based decision-making. In other words, what steps are you going to follow in order to use the screening data to make decisions? Articulating routines and procedures in writing helps ensure and assess if established routines and procedures are being implemented with integrity. Ongoing evaluation of the selected routines and procedures is necessary to ensure they are culturally and linguistically responsive and that they are helping lead to the desired outcome. If you are thinking about establishing routines and procedures for data-based decision-making, consider clarifying the following points in writing prior to implementation. What are you looking for? We all know that data fishing can be fun, but it may also lead to problems. It can cause sites to delay the use of data, change the focus of the analysis, or miss important trends or issues. So identify what you are interested in knowing prior to your data analysis meeting. If you're unclear as to what you are looking for, conduct an evaluation of the more critical outcomes first. For example, you may consider reading performance or graduation rates, and then focus on outcomes in other areas. It is important to prioritize. Second, you may want to identify what you are looking for at all levels of analysis, including the district, school, grade, class, and individual students, and also what you are looking for at different levels of prevention system. The second question you may ask is, how will you look for it? So develop a plan for how you will systematically analyze your data. This can increase the efficiency of your data analysis activities. It also helps manage the output many data systems offer. Only the most critical data are needed at first. It allows you to know where and when to delve deeper. The final question you may want to ask is, how will you know when you have found it? Determine how much evidence is needed for a team to identify the success or lack of success of a particular intervention or process or instructional program. Once identified, the team can continue moving through the problem-solving process in order to develop a plan of action. Teams might also consider articulating and writing specific decision rules. They may want to define what happens when certain things occur, such as more than 80% of students being at or above the cut score. What might they do if less than 80% of students have reached the cut score? Do we need to strengthen the core instruction and curriculum? Should we add an intervention for all students? If lack of progress is evident, what should the team do? What should the plan look like? And it may be important to evaluate what will be done if student progress varies by target group. For example, if student progress varies based on their participation in Title I programming, special education services, or if they have low socioeconomic status. Decision rules should be established at all levels, including the class, grade, and school. Data collection is not nearly as difficult for teams as data analysis. Screening data can assist teams in answering many of the questions they are asking. However, data analysis can be overwhelming, and this graphic is intended to demonstrate how overwhelming it can be. Please keep in mind that all data presented in this presentation are fictitious, but they are representation of data that a school or district may use. Many data systems provide users more outputs than they know what to do with. Teams struggle with where to start, what data are most important, and what data provide the information they are looking for. Data systems can help manage information. However, if you are unfamiliar with the data system and what it has to offer, you may be paralyzed by its outputs. As a group, we will discuss some of the different types of data analysis that can be conducted with screening data to further the decisions that teams may make. Data analysis should occur at the district level, school level, grade or classroom level, and at the individual student level. The purpose of data analysis is to identify individual students who may need additional assessment and instruction, evaluate the effectiveness of the core curriculum and instruction, allocate resources, and evaluate the effectiveness of instruction programs for target groups of students. This slide shows some of the more common terms that are often confused that you may see while analyzing and interpreting data. You may have seen these terms used interchangeably, especially by publishers of screening tools. For purposes of this presentation, we refer to these terms as follows. A cut score is a score on a screening test that divides students who are considered potentially at risk from those who are considered not at risk. Target or benchmark is a predetermined level of performance on a screening test that is considered representative of proficiency or mastery of a certain set of skills. Criterion scores are scores on a screening test that separate students into performance levels, for example, established, emerging, and deficient. The target or benchmark is more often than not the same as the cut score, especially when the cut score is predictive of the state test. However, it does not have to be. For example, schools or districts may choose to set a higher benchmark or target than may be predictive of passing the state assessment, while setting a cut score that is more predictive of who is at risk or not at risk. This is why it is essential for teams to understand how cut scores and targets and benchmarks were established. The term cut score is sometimes used to refer to criterion scores that separate students into those performance levels, which are commonly depicted by the green, yellow, and red highlighted students. It is important to remember that the purposes of these two terms, cut score and criterion score, are different, and we'll talk more about this in a moment. Before we begin analyzing some sample data, it's important to make sure everyone understands how screening data may be presented. Although we will be looking at fictitious data, the procedures we will be using can be applied to almost any type of data. Screening data can be interpreted in several different ways. What you are interested in learning will determine what data you might use, whether it's norm reference, criterion reference, or target scores, and how you will choose to interpret the data. We will discuss each of these further. When using norm reference data, students are measured against one another. There is not a defined criteria. It also permits a fixed proportion of students to pass or fail an assessment. This means that the standards may vary from year to year depending on the quality of the cohort. And it is an effective way of comparing students to their peers. Comparisons using norm reference data can occur at different levels. Students can be compared to other students in their class, school, or district, or against national or state norms. For example, the Whisker plots shown in the next couple of slides provide examples of the comparison of students at the class, school, and district level. National norms and state norms are derived from formal norming studies. Norm reference data compares an individual against his or her peers. A common way these data are represented is through a bell curve. In the middle of the bell curve is the midpoint or median, or the 50th percentile. Half the population is to one side of the line, and the other half is on the other side of the line. In a normal distribution, the majority of people fall near the middle, creating the perception of an average. The farther away from the middle, the fewer people you will find. In the education field, imagine the students who are very high achievers on the right end and very low achievers on the left end. In a typical classroom, it would be expected to have a similar distribution of skills among students with very few high and very few low achievers, and a majority of students possessing similar skills toward the middle. Box plots are a common way to graphically represent norm reference data. Think about the bell curve turned on its side. What you end up getting is a box plot. Box plots are somewhat similar in shape and representation. In a bell curve, the middle line is the median score or 50th percentile. In the box plot, it is the middle line. The box represents the majority of the population, from the 25th to the 75th percentiles, while the lines above and below represent the 75th to 90th percentiles and the 10th to 25th percentiles, respectively. Students who fall above or below the box are considered to be outliers. Box plots are helpful in comparing different groups or cohorts of students. They focus on where the average students fall instead of the outliers. This is an example of an individual student data for a grade 2 screening measure. This box plot compares an individual student to his peer group. The class or grade is represented by the box plot, and the student is represented by the dot. This level of analysis would be appropriate for identifying students in need of supplemental support. As you can see, the average score is about 45. Students at the 90th percentile scored about 70. Students at the 10th percentile scored about 15. and the score for the student that scored well below his or her peers was about 8. In this example, you can see that the student is performing well below his peer group. Norm reference data allows us to make comparisons between groups. In this case, a school compared to other schools. This type of analysis would be helpful in identifying which grade levels may be in need of additional support. The green box plot or comparison group provides a composite of all students in the state who have completed the same screening measure for that grade level in the fall. The gray box is School A's scores, and the black line is the target score. How does School A's first grade compare to the state's composite norm for first grade? Although the median score for the state is below the target score, the majority of first grade students in School A are below the target, suggesting that this school performs much lower than the norm. However, in grade 2, the school is performing slightly better than the norm. What about third grade performance in comparison to peers? For grade 3, the state norm is well below the target score, but even worse, all students in School A are performing below the target. It may be worth noting that because most students, including those in the comparison group, are performing below the target, that teams need to determine if a larger systemic issue is affecting student performance. For example, they may need to consider whether they have ineffective policies in place, ineffective curriculum, or if additional teacher training is needed. Turn to the norm-referenced box and whisker plots handout. As a member of a district-level data team, you are looking at the norm-referenced screening data for one school in your district, School A, compared to the composite for the state. What does the information in the graph tell you about School A? Pause the webinar to answer the questions on the handout. We will now review possible answers to the questions. Not all possible answers are represented. What is the cut score? The answer in this example is 60. What is the 50th percentile performance for the composite? The answer is approximately 75 for the composite and approximately 55 for School A. What is the spread or range of scores for the composite? The range of scores is approximately 30 to 120. For School A, the range is approximately 47 to 71. What might the difference in spread between School A and the composite tell us? The spread for School A is much narrower than for the composite. This may suggest the need for additional analysis to understand why the scores of School A are so limited. It might suggest that the teachers are teaching to the test rather than developing the overarching skills of their students. What might you say about the performance of School A compared to the composite based on this graph? You may consider that the median for School A falls below the cut score, whereas the median for the composite falls above the cut score. This suggests that for the composite, more than 50% of students are reaching the cut score, while at School A, less than 50% are achieving scores that are at or above the cut score. As we just discussed, the distribution of scores for the composite is larger than for School A. This means there is a larger range of proficiency between the strongest and weakest students in the composite compared to School A. So what additional questions might you ask based on these data? Some sample questions may be, why is the distribution of scores so narrow for School A? Or what supports are needed in order to help improve the overall performance of students at School A? If you are using Criterion reference data, you are able to evaluate students against a defined or objective criteria. Criterion referenced assessment is often, but not always, used to establish a person's competence or whether or not he or she can do a particular skill or set of skills. Criteria typically do not vary from year to year unless there is a change in what proficiency standards are required. Norm reference data compares students to one another, but Criterion reference data compares a student to a preset criteria. There are multiple ways to determine criteria. One example is percentile ranks. For example, below the 10th percentile may be an indication of a student performing in the deficient range. 10th percentile to 25th percentile may suggest a student is in the emerging range, and above the 25th percentile may suggest a student is in the established range. This type of data representation is what is often associated with the triangle. In fact, if you turn this upside down, you will see where the triangle graphic originates. The first table shows how students could be grouped if norm reference data are used. In this output, students are compared with their grade level peers. Some students fall in the upper performance level, others in the lower performance level. This type of data output allows the grade level teachers to see which students have the lowest and highest proficiency in the class and what the average performance group looks like. This can assist with grouping students for the purposes of differentiated instruction. The second table presents the same data using Criterion scores to identify students. In this data output, you can see that all students are performing below the preset criteria. These data can assist teachers in evaluating the efficacy of the core program. Analyzing data in multiple ways can allow for different kinds of questions to be answered. For that reason, different kinds of data sources can be useful for educational decision-making within your school. Database decisions can also be made using established benchmarks or target scores, not just the Criterion reference scores. These scores are typically based on statistical analysis and can be correlated with high-stakes tests. Using target scores can assist with determining overall efficacy of a core curriculum and instruction, while Criterion reference scores can help with groupings of students for instructional programming. The target score is typically a score where teams can feel confident that students have mastered or are proficient on assessed skills. In other words, these are students the team is confident will not need additional assistance. In this example, several students who met the established criteria fall below the target score. Although they are demonstrating established skills, we are not confident that they have mastered these skills. Thus, they will remain in the established range. Sites may consider progress monitoring these students to ensure that they continue to make progress in the general education classroom. Earlier, we mentioned the district-level decisions that can be made using screening data. These include decisions about program improvement and curriculum, innovation and sustainability decisions, including determining the general effectiveness of implementation and of an RTI model implementation. It can also help ensure equitable services and supports across schools, and access to supplemental supports, access to effective instruction, and perhaps even initial indication of a student who may be at risk for a learning disability. Allocation of resources and professional development can also be used by evaluating data at the district level. Districts could use data presented in this manner to compare schools at different grade levels and answer questions about effectiveness. For example, is primary prevention working for most students in the schools? Districts can also use these data to make decisions about resource allocation. For example, which schools appear to need additional support or further analysis. Turn to the district-level box and Whisker graphs handout. Pause the webinar to complete the questions. We will now review some of the possible answers. What does the information tell us about how primary prevention is working in the schools in our district? There's a lot of variation in performance across the schools and grade levels in the district. The median score for some schools in the district is above the target across all three grade levels and seems fairly consistent with state comparisons, while other schools seem to be struggling or struggle in one grade level. This variation may be especially worrisome to a district that is implementing a standardized curriculum. Which two schools in this district seem to be struggling the most? The answer to that question is School E and School A. Which school in the district seems to be doing the best? School D. What decisions might the district make about resource allocation? For example, which schools appear to need additional support or further analysis? Looking at the data, the district may consider trying to determine what is happening at School E that causes it to perform lower across all three grades. it may be necessary to allocate additional resources to School E in order to bring the scores up. In schools where one grade level scores below the other grade levels, it may be necessary to do further analysis to see if additional resources need to be targeted at a specific grade level in order to improve scores. Districts can also look at district-wide performance by grade level over a school year. This chart shows changes in the percentage of students meeting the established Criterion scores for each benchmark period. This chart indicates that although only 55% of students met the criterion for established at the beginning of the school year, 80% met it by the end of the year. In general, it appears that instruction in grade 2 is effective for most students. The district may be concerned, however, that many students did not enter grade 2 meeting the criteria for established. Teams may ask themselves, what happened in first grade, or why is second grade having to catch up? Districts can also analyze performance by subgroup. Are students in Title I performing similarly to other students? Are students with disabilities performing at similar rates as students without disabilities? It appears, based on these data, that students in the other category who are not identified with a specific status are outperforming the target group in this district, yet both Title I and special education populations fall below the target or benchmark score. It is also important to note that compared with other groups, students receiving special education services are not making the same amount of growth across the year. The district would need to obtain more information about special education students to determine why they are not closing the gap. It is also important to consider district-level data and first identify district trends before looking at school or even individual student-level data. Not only are you able to see the differences in performance of different groups in the spring, but you're also able to look at their growth rate or slope across the entire year. Please note that in this example, special education refers to students who have an identified learning disability. Students receiving special education services may still be receiving instruction within a general education setting. You may also compare performance across ethnic groups. This graph shows that some ethnic groups are not performing at the same growth rate as others. Just as with the previous slide, you can look at the difference in growth rate or slope across different ethnic groups. At the beginning of the school year, this district was able to see that there was a gap in the performance between English language learners and non-English language learners. After analyzing for root causes and developing an implementation plan, the ELL's performance improved over the course of the year. Although their performance does not match the performance as their peers in the school, the gap between their performance is closer to the target than it was at the beginning of the year. As you can see, depending on how your screening data are coded, districts can use the data to analyze performance of differences across a variety of factors, including socioeconomic status, grade level, curriculum, school schedule, or other areas of interest. It's also important to consider school-level data analysis. You can use these data to identify school-level trends or issues. Are there holes in grade-level performance? Do we lose certain subgroups of students at certain times of year? We can use the data to evaluate the effectiveness of school-wide curriculum and determine areas of need and guidance for selecting, and use the data to create measurable school-wide goals. Schools can analyze performance across grade levels. This graph indicates that grade 2 and grade 3 may need additional support. A school with these data would first identify general trends and issues, next analyze potential causes, then develop a plan, implement and monitor that plan, and then evaluate and adjust the plan based on the ongoing data they collect. These data could also be used to help guide basic resource allocation across grade levels. Schools can also look at growth by benchmark period and by grade level by looking at the performance of the average student across different grade levels. The average student appears to be making growth at all graded levels, with more growth in the earlier grades in this example. Schools, like districts, can also look at growth by target group. Turn to the Analyzing Growth of Ethnic Groups at the School Level handout and pause the webinar and use the data provided to answer the questions. We will now review some of the possible answers. Which ethnic groups are performing above the target score in this school? The answers are Asian, Caucasian, and the unidentified category. Which ethnic groups are performing below the target score? The answer in this example is African American and Hispanic. Consider the growth of students by ethnic group from fall to spring. What does this tell you about the achievement gap between ethnic groups? While there is a difference in the fall between the students identifying as Asian, Caucasian, and unidentified and those identifying as African American and Hispanic, the widening spread by the spring suggests that the achievement gap is actually growing across the year. This is a cause for additional concern because the rate of improvement for some ethnic groups is outpacing that of other groups. Asian, Caucasian, and unidentified students are actually making more growth across the year than African American and Hispanic students in this example. That means that the gap between these groups is widening over time. If these data represented your school, what next steps might your team consider? At the grade and class level, you can look at grade and class level trends, effectiveness of grade level curriculum and instruction, areas in need of additional guidance, and you can use data to set measurable grade level goals. You can also identify students who may require additional instruction or assessment. When analyzing data at the grade level, it is important to remember that the focus is on grade level data and not individual students. So look at the big picture first. It should be an efficient and systematic process. Remember, your model may look different to make it more efficient for your context. Data analysis procedures should be efficient and systematic processes that have been pre-established for your team. Analysis must guide and inform core instructional decisions. Grade-level data analysis should not be about compliance, but rather about improving the efficiency and effectiveness of your instruction. Grade and class level teams can also look at screening data to see the effectiveness of the core curriculum and how changes to core instruction influence students' responses across the school year. This is an example of grade level data. A similar process could be used for class level data. Turn to the grade level Analyzing Effects of Change to Instruction handout. Pause the webinar to answer the questions based on the data provided. We will now review some of the possible answers. Overall, how are the students in second grade doing in the spring? Has this changed across the school year? The data indicate that the change led to improvements in the number of students meeting established criteria. Between the winter and the spring, the percentage of students meeting established criteria increased from 53% to 76%. The change in instruction led to an improvement from the winter to the spring, but the growth across the entire year was minimal, from only 73 to 76%. What percentage of students required tertiary prevention during the spring? What questions might you ask about this? Approximately 10% of the students are likely to need tertiary prevention during the spring. This is twice the typical recommendation of 5%. Across the entire year, there has been a high percentage of students being identified as deficient or requiring that tertiary instruction. This is something that might cause concern and need additional evaluation by the school's RTI team. How might this be different if you were looking at district-level data or school-level data? Schools or districts might consider how the distribution shows a need for additional resources or supports in order to address the low level of students responding to this instruction in the winter. They might consider making curriculum changes or implementing additional professional development to support teachers in their implementation of the core curriculum. Growth, just like at the school and district levels, can be analyzed at the grade and class level. Given the large amount of data at the district and school levels, some gaps at the grade or class level may be missed. Class and grade levels should follow the same data analysis routine to identify potential gaps in performance. Just as with district-level analysis, you can look at the data by target group, ethnic group, or ELL status. In this example, the general education students are making progress above the target score, but special education students remain below the target score and are showing little progress. In this graph, you can also see the difference in growth by the different subgroups in the class. Students receiving special education services have made almost no growth across the year, indicating that additional supports may be necessary for those students. This chart shows the average performance of 4 fictitious classrooms. Teams looking at classroom data can compare student performance across classrooms at different points in the year. Teams can also look at the data to make decisions about resource allocation, instruction, and evaluation of the core curriculum, not to evaluate teachers. There should not be fear about the data among teaching and school teams. The discussion should be open. This graph shows that in the fall, the classes are performing at different levels. The school may need to allocate resources appropriately to ensure that classes 1, 3, and 4 can close the gap. It looks like Class 1 made a lot of gains. This may be a result of additional resources, fidelity of implementation, additional teacher training, or other variables. Further analysis may be needed to determine and address performance differences. Spring data indicate that, on average, students in classes 1, 3, and 4 are not performing similarly to Class 2. Adjustments may need to be made in the following grade to account for these differences. It may also be worthwhile for this teaching team to evaluate the consistency with which they're delivering instruction across the classes in their grade level. Ranking graphs can also be used to conduct student-level analysis at the grade or class level. This type of analysis can allow you to see how individual students rank against other students in the class or grade. Teachers can use this information for differentiating instruction or to create small instructional groups. For example, you may group the students in the black boxes together to provide additional intervention. When class and grade level analysis is complete, data teams may consider looking at the performance of individual students to identify who needs additional support in comparison to their peers. With screening data, individual students' performance can be compared with that of their peers. If you look at the green boxes, you can see that the group appears to be making progress over time. While the student shown by the blue dot is making some progress across the year, his progress appears to be insufficient to close the gap with his peers. In fact, if you look closely, it appears that the gap may actually be increasing, as shown by the growing difference between the 50th percentile of the peer group and the student's benchmark score. This may be a student who requires additional support. Analyzing student data are important not just for students who are struggling. It is important to also ensure that high performers continue to make appropriate levels of progress throughout the year. This may also be a student who needs additional support. How are screening data used to determine who will need supplemental support? After determining the effectiveness of primary prevention and establishing instructional plans for improving core instruction, teams can begin to analyze data to determine which students need additional support. Identifying students in need of additional support is not always as simple as providing interventions for all students above or well below the cut score or target score. It may vary based on the needs and resources of the school and the target or criterion scores chosen. There may be more students below the target score than can be served by existing resources. Schools and districts may need to identify the lowest percentage of students whose needs can be met using existing resources, for example, 20%. And they may need to think about reallocating resources or securing additional funding to increase the number of students they can serve with interventions. Keep in mind that if there are many students below the target score, for example, more than 20%, there must be some changes to the primary level or core instruction. And so the focus should be on improving that core instruction in addition to providing interventions for some students. Practitioners can use Criterion scores from Criterion referenced assessments to determine what level of instruction supports students may need. In this example, students in the yellow may need secondary support, while students in the red may need tertiary support. Although this method does provide established scores for grouping, it can lead to challenges for schools where a large number of students fall into these categories. This graph provides an example of a situation where most students fall below the cut score or target score. If cut or target scores were used to determine supplemental intervention in this district, then School 3 would have significantly more students to support. This would be an issue of inequity in terms of resources. The focus for all of these schools, given the high numbers of students in need across buildings, should actually be on improving core instruction and curriculum, in addition to providing interventions for students with significant needs. Another way to identify students in need of support is to use target identification rates. This is different from the cut score or target score. The target identification rate is the proportion of students to be identified as at risk. This may depend on the program objectives and resources. There might be unique target identification rates specified for different skill areas. For example, a school might decide to select a larger target identification rate for word readings than for comprehension due to resource availability. Schools and districts will also need to think about reallocating resources or securing additional funds to support all students in need. It is important to emphasize that using target identification rate to identify students at risk does not mean that students are not responsible for teaching all students. Ideally, schools should provide extra supports to all students who demonstrate a need. Setting target identification rates can be the first schools while students are A, strengthening their core curriculum to reduce the overall numbers of identified students, and B, reallocating resources or securing additional funding to support students who need interventions and support. This is an example of how the target identification rate may differ from school to school. School 1 has resources available to serve 20% of the students in the secondary or tertiary intervention levels. Therefore, it sets its target identification rate as identifying the lowest 20% of students as requiring interventions. In contrast, School 2 has only enough resources to serve 15% of students in the secondary or tertiary levels of prevention, so its target identification rate is set to only identify the lowest 15% of students. Regardless of a school's target identification rate, if more than 20% of the population is identified as at risk, the focus should be on improving core instruction and curriculum. The district should help identify resources available and help guide schools in allocating resources to support all students who need additional help. When making database decisions, it's important to remember these things. First, good data in means good data out. Know where your data come from and the validity of those data. Focus on the big picture for all students. Are most students making progress? If not, what can we do differently to improve instruction for all students? All instructional and curriculum decisions should be based on data. Keep data collection and evaluation procedures simple and efficient, and teachers and leaders should be able to trust the data that are collecting. When working with assessment data, consider these questions. Is there a simpler way to do this? Do we need these forms or processes? And are we getting to the point? Thank you for taking the time to listen to Using Screening Data for Decision Making. To find more resources on this topic or to view other webinars in the Implementer series, please visit www.rti4success.org. You can also view additional information from the RTI Action Network and the IDEA Partnership.